This truly is once in a generational stuff we're doing, being able to open up a new hospital within Orkney. We're leaving legacy for generations of Orcadians to come. Not everybody in Orkney knows and loves the Balfour Hospital, but I don't think there was any doubt in anybody's mind that the physical constraints and the physical condition of that building were not where we wanted to be.
Unfortunately, the main part of the building has been well past its use-by date. So really, Orkney, after 70 years, really deserved a new hospital.
Well, I was privileged to be on the dialogue team, and I was in the room the very first day Natalie Duthie showed us the proposed design. But before that, she showed us Skara Brae, so an aerial shot of the Skara Brae site. We're wondering where this was going as she comes further and further away from it. And then this design appeared on the screen in front of us. And it was just that wow moment.
You know, it's important to have a sense of identity in any building, and the opportunity here was unique to really try and tie back to something that is only Orcadian. The curves of the building and the way that they create the sheltered space was an opportunity to do that, whilst also, and more importantly, really addressing the clinical brief. It's a rural general hospital, so it has almost every department that a larger hospital has, but on a much smaller scale. But then you still need to achieve the flows and the connectivity within that as well, so that has to be #1 priority.
The building houses a range of NHS services that are quite unique in nature. So we have primary care, acute care, we also have some elements of social care, we have office accommodation.
There's 2 theatres, there's CT rooms, there's a dental surgery, there's a Macmillan cancer unit, there's 2 doctors' surgeries coming in.
Radiology, obviously we have an emergency department.
We've got a purpose-built pharmacy, purpose-built laboratories. We've got 100% single rooms in here.
We're nearly finished, Rhoda.
Yep.
How has it been for you overall?
Exciting. I think it's just as simple as that. We're delighted with how it's looking and that we've got the adjacencies we need for remote and rural healthcare. But I would imagine that probably gave you some challenges.
Absolutely. It's been a challenging building to do because it's a very challenging environment to work in. Bringing material and accommodation, flights. Materials have been specified very specifically for Orkney's challenging climatic conditions. So
obviously the salt content is a lot higher here, isn't it?
Absolutely. Driving rain, wind-driven rain, very challenging, very testing for a building.
The NHS Orkney project team have been fantastic, and the repatriation of services from the likes of Grampian gives them the opportunity to deliver locally to the 20-odd thousand people of the Orkney Isles.
It will allow people to stay at home and get more and more treatment here. And I think that it will only enhance what is a first-class health service.
It was always clear that Robertson understood our needs and our requirements. We were not looking for a builder, we were looking for a partner to take our project forward.
The professionalism and the honesty, they listened, they reacted to our challenge, and I think that the attitude to the health and safety, it's been absolutely amazing actually. It's exemplary.
The whole ethos is about open, collaborative approach. It's open and honest all the time.
And I think what we've done just now is put the grounding in place for a very successful long-term relationship with the client.
The thing I would sum up about this building is that I think it's a little gem. I think it's a wonderful building. I think it will serve the people of Orkney really well for the next 7 decades. I'm going to say that out loud. And I couldn't be prouder to have been part of it.